Yay, I think we're live. Okay, with a little bit of technical headaches and far too much loss of my hair, I'd like to welcome you all to joining me on this presentation, this short webinar that, I've put together to try and help demystify a little bit of what we can think about with red light therapy, the benefits, because it's such a possibly polarizing experience for folk. And my goal was to try and demystify this in a little bit of a short presentation where we cover some of the fundamentals, where the science is, and possibly what you can expect as well. So I'm going to share my screen, and if I could get everyone just to, before I kick off, drop something in the chat if you can, to let me know that you're hearing me loud and clear. And also, if you've got any questions that you might be sitting on with regards to the role of red light therapy and our cognitive health, our cognitive function, any questions there? I'd love you to drop any comments in the chat. So with that in mind, can I get a bit of a show of hands, folks, in your little chat panel? Just would love to see what your thoughts are here. Drop me a bit of a, you can hear me? Yes. And any questions you might have. All right, I've got hands up. Lovely. Got a few hands up. Thank you. Well, I'm taking hands up that were, oh, yes. Oh, lovely. A sea of golden, beautiful hands on the side here. That's great. Okay, wonderful. Well, I'll get started. Let me set up my my screen here on my side. Okay, want to double check that everyone can see my screen. I think we're good. I'm going to enter a full screen mode and we'll go through the slides together. So thanks so much again for joining me. I wanted to perhaps help, after doing a professional presentation a couple of weeks ago to some colleagues, it got me enthused to think about what I could share with folk in our community to understand some of the opportunities associated with red light therapy. Now, I'm using a term here, red light, because often it's a red what? And it's a curious question because a lot of people are questioning about what is he talking about and how could this help my brain? So that's really my purpose today, is to try and demystify a little bit of the science and maybe raise our understanding about what this particular treatment approach, the background of it, is it safe, and how can we apply it possibly in our daily lives, and who could this be, relevant for? So a little bit about me. My name's Dave Norris. Many of you folk will know me through Occupational Therapy Brisbane. Some folk will know me through a podcast that I have, which I do record now and again, but it has been a little bit time since my last recording. My background is occupational therapist, and I guess my focus for folk is what can we do to get in front of the curve, particularly when living with neurological conditions. I'm extremely passionate about understanding and supporting folk with their cognitive health journey when we're up against it, when we're living with Parkinson's, dementia, etc. So with that in mind, I thought this would be helpful, but a few disclaimers here before I dive further. This is not me imparting a therapeutic advice today. My intent for this is just an educational presentation. The goal here is not to take this on board and think of it as a direct application for your life. If that's what you want, please, that's the time that we have a face-to-face or a session together and we go through your specific situation and see how this type of technique and therapy approach might apply to your situation. I'm not a scientist. I'm not a neuroscientist. I'm an occupational therapist. So I bring a very practical lens to this, where my vision is to think about tools that can help improve our performance, our function. That's what I'm most interested in. And that's the things that I try and put in my toolbox. So with that in mind, let's dive further. So red light therapy. Well, I'm doing a little bit of play on words so we can grasp onto it, but it's a little bit more expansive than that. So the term that's often used in the scientific literature, and when I'm talking with colleagues, is a different term. And we would often refer to this as photobiomodulation, or PBM. So let's break it down a little bit. light being photo, B, biological, and modulation or change. So we are looking at the relationship and effect of light on our biology causing a change. That's to unwrap it. And red light therapy represents obviously a part in that spectrum. If you think about it, we've got a really strong relationship with light as it is. Sunlight is one of the most powerful tools that we've got, particularly about our timing of our daily routines or our daily function in our bodies. It helps synchronize our sleep and wake cycles. Our exposure to light helps trigger a whole cascade of changes inside our body or biology. So we've got a relationship with light as it is. And if we think about other times that we've seen the power of light on our bodies, nothing more so than comes to my mind, especially when seeing young bubs and their ability to break down bilirubin, that liver byproduct in those early days. So you'll see blue light being an effective tool. We're not looking at blue light. We're looking at a part on that light spectrum called red light and near infrared. So what's the effect on the brain and how does it actually help? Well, as I mentioned, we've got light happening at different wavelengths. And in our visible light spectrum, if we go down to the bottom of the page, you can see that there are certain fields of light we can see. There are fields of light that we can't see. And light is energy. And one area that we focus in on is red light within a certain spectrum around the mid 600s in that wavelength. So light comes in as waves, and we're looking at a particular length of a wave that's around the mid 600s. Then we're looking at another band, which is then the infrared. So this is now outside of our visible spectrum of light and in the infrared. So it's just outside of our visible spectrum, and we're looking at about the mid 800s, just up to over 1,000 in terms of its size of its wave. So what we now have is an understanding that light has an effect on our body, and when it comes to our brain, we're looking at a specific part of light or wavelength of light, that red or near infrared. And that seems to have a good biological effect on our brain. So as mentioned, it's the mid 600s and it's around the 800, it's a bit over 1,000 nanometers in length. This is a really important point. If you're out there looking at devices for yourself and trying to understand what one might be helpful, well, this would be my number one criteria to start off with. Is it in the spectrum of the right wavelength? Is it doing something in the mid sixes? Is it offering something in the 800s to just over 1,000 nanometers? If not, walk away because it's not likely to be effective. So that's point number one. Number two is that there is a dosage effect. So when we receive this light, there is an effect on our body or brain. And there is an effect that we can have a small effect with a little bit of a dose, but then if we have too much, it has an inhibitory effect. So we don't get an effect, or it has a negative effect. So it's often called the Goldilocks zone, this zone of right dosage. And that's related to how much energy is imparted into the brain, how much energy is being contributed. So that's point number two here, is that if we're looking at things in the market as something to buy or consider, then we want to know, does it target the right wavelengths? And number two, does it help us with the right dosage? Because we don't want too little, we don't want too much, we want just right. Yeah, a bit like Goldilocks in a porridge hunt. We want just right. So we're looking for that. And that's information that's very, very helpful, particularly if you're thinking about, if I'm handing out my dollars and cents, I want to make sure I'm engineering a better outcome for myself. So they're two important considerations. So how does red light work on the brain? How does it, probably the next question to that is, well, what is it we're looking at? So if we take our beautiful brain on the left-hand side, and inside our brain, we've got cells, and there's a whole host of cells, and I'm going to get crucified here by this not being a particularly accurate or descriptive look of a cell, because there's lots, and we'll have neurons, which is the working unit of the brain, and we'll have helper cells, those cells that support neurons' functions. We'll even think in this bucket the blood-brain barrier. But I'm not going to confuse us any more than to say, hey, in our brain, we've got these things called cells, tiny working units that help us and our body perform better. We've got billions of them. And inside those cells is the mitochondria. These mitochondria are considered, as my interesting picture down on the right-hand side, you won't find this in your brain, nor inside a cell, but let's think of these mitochondria, which live inside the cell, as the battery units. These are the units that help generate energy. And when living with neurological conditions, be it Parkinson's, dementia, depression, Huntington's disease, MS, etc., the current line of thinking is a disruption in the mitochondria's efficiency. How well is it performing? And so when we're looking at red light, it's having an effect on the battery. It's having an effect on the battery to create more energy. It's helping that battery be more efficient. So that's the first effect. And we'd often call that the primary effect. That primary effect in creating more energy. Think of it like a waterfall. Light comes in, it has a particular target on the wall of the battery. That gets excited and contributes to change. And the change output is more energy. The knock-on effect, much like a waterfall, so we're going down, and the consequence of starting that water at the top is it's going to fall and cascade further and further. The knock-on effect is quite variable. So what we have is creation of energy, and then it then kicks off a whole host of changes around the nucleus, the part of the cell, the heart of the cell, to create more information for the cell to behave differently. It has an effect inside the cell and outside the cell. Inside the cell are different things that kick off, and outside the cell, it's almost like communication that happens to affect its neighborhood. So from one action of creating more energy, we're getting changes inside the cell. Let's go back inside that cell and then outside it. So there's a knock-on effect on many different functions as a result of this. What is it inside the brain? So we've got the image here of the red light, or the wavelengths of light coming down, and the PBM is referring to photobiomodulation. Let's call it red light. I know I'm going to get crucified for this, but it's an easy one for us to understand. Red light comes in. It's penetrating up to about 5 centimeters. So yes, it does traverse the skull, and yes, it can target the tissue, being our brain, underneath it for about 5 centimeters. And that's about the maximum depth we'll get. So that makes it challenging when we want to try and get to deeper structures. But what is the benefit of that? Well, let's unpack this a little bit more, and I'll remove and try and explain some of these terms. So number one, edema. Well, we kind of probably understand that. Reduced swelling. We have increased drainage. So much like the plumbing system, we're having that swelling moving out by better drainage. We have increased blood flow. So we're now getting positive things into the brain through oxygenation. We're getting fresh, beautiful blood coming in. There's a beneficial effect of increasing those neurons. Remember those working units in the brain? Well, they create more of them, and they create them more into maturing neurons. So they go from baby ones, much like watering a garden. We've got little baby shoots that come through, And then we get ones that mature on into being a plant. That's a lovely way to think about the development of a neuron. Very important when we start to think about different skills like cognition and memory as one, language skills, sleep behaviors as one others. We've got reduced inflammation. We've got a whole host of neurochemicals or neurotrophins, trophins being positive communicators for better brain performance. And they send out signals that say, hey, let's grow more endings to those neurons, much like think about the tree roots or the sprout roots growing up in the garden. We've got those little roots growing out to communicate with others. It helps also with pruning them. Nothing like a good tree when it's trimmed back to go, this is actually the shape we want for it to get the best performance. Another part of it here is it sends out the cleanup crew, or helps contribute to the cleanup crew. That is those cells that go out there and clean up the rubbish, the things that are possibly cells that are behaving badly, getting rid of the debris. So we've got a cleanup through action happening here. And we've got reduced overexcitement of the neurons. So having them in a state where they're firing off all the time and without any inhibition. Now, if we're to think about that, that's a classic presentation of Parkinson's disease, where we've got too much excitement happening and not enough inhibition, which is trying to turn that tap down on those signals so that we get a clear communication happening. If we have too much noise, it's harder to get clarity. So these are some of the things that have been reported in the literature, and I cite Professor Hamblin, who's now retired, but he's been one of the pioneers in this space and looking at how does it affect the brain? How does red light therapy, and again, I'm going to put it up there, I'm going to get crucified, but how does photobiomodulation help the brain? So, can we penetrate the skull? We've kind of got the idea, yes, you can, but how do we get it there? Can it get in there? Well, let's have a look at a couple of ways it can get there. We've got devices that you can wear on top of the skull, and it's then being able to penetrate up to those 5 centimeters. I've got there as intracranial, so something going inside the brain, so it has to penetrate the brain. Some very interesting studies done by the Russians where they used cannulas through the leg in folk that have had strokes, and then using small little diodes, so light emitting devices at the point of where the stroke happened. And it's delivering that red light therapy right to where it wanted to be as a target tissue. Obviously, that's not within my scope of practice or something I'm willing to do, but that's another application. We can also look at it from an off the skin, or not direct contact to the skin, but off the skin. And that's something that we see, say, through intranasal devices. So something that, say, clips on the nose, and it's not directly making contact with any skin, but there's a distance there, and it's then emitting the light from there. We see that through folk receiving through their tummy. So the light being either away from the tummy, so off the skin, or direct contact to the skin. So what I'm showing here is that we've got a direct approach. So we're trying to focus on the target area, as well as an indirect approach, which is going away from it and using a different area. And the differences is that we have a systemic benefit, which has a whole body approach. And for some folk, getting things near their faces is very confronting. So other points of benefit can be through tummy, so using light at the tummy, or in our hands, where we've got lots and lots of blood supply coming into our hands, and we can use that as an access point, particularly for ease of contact or ease of access, and allowing that light to then have an effect on blood or blood cells. And that has a direct approach or an indirect approach. Let's go a bit further. What are some of the tools that are out there? Well, to help unpack this, we've got wearable headsets, big, almost like bike helmets on the top left. That's Neuronics products. Through to Simbex. Simbex is a little bit different. They've got a suite of tools that they've designed for folk that are living with Parkinson's disease. Their particular tools are a headset, a bit like an open LED headset. So they're using LEDs, and you see a little wand next to it, and that's a handheld wand that is a laser, and it's a cold laser. So it's not having a burning or a heating effect. Down the bottom corner, we've got some of the ViLight, VIE-LIGHT light products. And in this particular one, we've got the nasal peg as well as a cranial headset. And in the middle there at the bottom, we've got a standalone product that sits on a desktop or on a tabletop. And it is then offering the light source from a distance from the body. And that's where you could say to the tummy, to the hands, to the back, to the feet. They're offering different pathways, but that effect, that response using that type of tool is very much a systemic approach. It's trying to help the whole body, which there are benefits. Interesting study that was published around just looking at mice models. So we've got to take this with a little bit of grain of salt. A mice study looked at the effect of photobiomodulation near infrared. So they were focused on the 800 to 1,000 wavelengths of light. They used that one. They had mice that had direct to the brain. So they had a mice group that had a simulation of Parkinson's disease. They then did light to the head, and they covered this poor little mouse with tin foil so that nowhere else got it other than the head, other than the skull. And then subsequently, they then, on another group of mice, covered their head and then just provided distantly, so from a distance, the red light to the tummy. What was fascinating was there was no significant difference between the two groups and their cognitive performance. So what we saw is that you don't sometimes need to go after the target tissue. You can have a systemic effect of which there are benefits. And if we come back to some of those things that we saw before, there's inside the cell and outside the cell benefits. And it appears to be the outside the cell benefits that have a whole body effect and an effect on the brain, particularly in that study. So let's unpack some of the information here around what does the science say about using photobiomodulation, red light therapy, for specific brain conditions. So in this particular study, small sample size, they were looking at clients living with mild to moderate dementia, specifically of Alzheimer's type. They did before and after assessments of cognition, as well as look at aspects of function. And that was around their sleep, that was around how they performed during the day, behavior, mood, wandering, so getting confused or agitated in the space. And what they observed was that for a 12-week program of using the products here, and they used products that were of the ViLight products. So they used one that had the headset and the nasal applicator. They observed that after 12 weeks, there was an improvement on the cognitive scale, significant, as well as an observed improvement in function. So we saw improved sleep, less behavioral change, so less anger, less anxiety, and there was a reduction in that wandering behavior. What was also positive in this study, there was no side effects reported or observed. So no agitation or pain, no bleeding noses. That might be something that some folk can report, but normally it's to do with how they put it on rather than the device itself. There was no discomfort. There was acceptance in using the tool. Interestingly, though, once it stopped and then a 4-week follow-up happened, there was a decline. So that was almost like returning back to baseline. So the effect seems to have a consistent effect in use, but once ceased, there was less of effect in going back to baseline. So it's a return to symptoms. And this seems to be consistent across the literature, that if we're going to use tools like this, it is going to be assistive, but possibly then if we stop, it's likely to have an effect. That's a small study, and there's certainly a call for more to happen after that. And there are actually current trials happening at present, particularly in the US. In the next study, looking at Parkinson's disease, and this group were looking at transcranial, so using through the head, they used through the nose, and they applied at the neck and tummy. And they were looking at, again, a 12-week period. Again, a performance improvement in mobility, in our thinking and memory skills, in our dynamic balance, in our fine motor skills. They improved significantly against those that didn't. They did it for 12 years, and then they followed up over a year. And they observed that there were improvements within the 12 weeks, but also they observed change sustained for a 12-month period. There were folk that had a take-home program and that were continuing to do it beyond. So you could then got to see the sustained effect over a longitudinal or a long period of time. So that was rather positive for that group. Again, small sample size, we could do with better and we could get more. Let's look at major depression and having a major depressive disorder. Again, both animal and human studies have identified that transcranial, so going through the head, so using devices on the noggin, particularly across the frontal lobes here and coming down the midline, targeting the default mode network, has been associated with improvements in mood. So again, the observations from this research group was saying that, again, safe to use, limited to no side effects, and having a positive effect. Again, another one calling and bell ringing to say we need more research and larger trials. So what's the scale of research at the moment? Well, current count for photobiomodulation as a whole, there's around over 10,000 articles published around photobiomodulation, specifically on cognition, the things that I've drawn out of the literature. I've got a sample of around 200 studies at the moment that give me a source of data that I can go to. Is it growing? It is growing. And that's really comforting for me. As a clinician, I'm really curious about what's the application to improve function. My observation when we're looking at these studies is that they are having an effect, but there's also a lot of things happening in the background. Folk are also exercising. Folk are also making choices about their nutrition. Folk are also trying to connect with meaningful activities and doing things that matter. So if we were to isolate just photobiomodulation or red light therapy by itself, it would be hard to say how much of an effect just by itself. But they've used some statistical analysis in these particular papers to help say, we can account for all these things. Now we can attribute that if we removed red light therapy or photobiomodulation from the studies, then we would see a different effect. So there is an assumed effect. So we've covered some of those things there, the research benefits, but let's do a bit of a high-level summary over the top. Well, we're looking at enhanced brain performance, and that's happening by cells performing better. Better energy, better metabolism, being how they're using resources, and there's better effect in terms of outside the cell. So there's things happening beyond just that tiny cell that's been affected, got the light. It's having an echo effect. It's having if I dropped a big rock in a pond, it's having a ripple effect beyond just that area. It's radiating and having an effect outside of that. There's, as we've touched on before, improved blood flow. And if there's something that's quite consistent in the literature around the cells that don't go on to mature, so we're thinking about those baby cells again, like the shrubs in the garden, those that don't go on to mature, the common thing associated with that is reduced blood flow. As we get older, we have reduced capillary growth. And that's a term we'll refer to as angiogenesis, increased blood delivery, those pipes that deliver the blood. We've got reduced performance of that. And so there is a secondary effect, remember that picture, that it's improving that blood flow. It's improving the networks of blood supply. So there's quite a number of different things happening here, things that happen at that local area inside that beautiful little cell, as well as having a wider effect, more systemic, beyond the boundaries of the fence of that cell, which is really fascinating for me. So when we're thinking about our brain and neurological conditions, what could we start to think about? Who could possibly benefit here? And again, I'm going to lean on Professor Hamblin's work here of how he's identified. We can think about those that have sustained a trauma, those folk who live with a condition that has a neurodegenerative pattern, so change over time, those that are living with a psychiatric condition, and those that are born with a condition and have a neurodevelopmental condition. There seems to be a lot here. And there's quite positive statements in the literature around these different populations or different disease presentations and how it can help folk. It really helps, and I guess, foster some curiosity and I think hope in us. But I want to leaven that space to say this is just one tool that possibly could be beneficial amongst many others. So not just one. Sometimes the question is, well, who should not? Who's the group that shouldn't possibly be? What's unsafe? And so folk that have a tumor in the brain, active tumor. Those that have had possibly a history of a tumor where there are still effects of the tumor resident. We don't want to have those effects of increasing blood supply and feeding that system or feeding that condition further. That would be something as a no-go. But you would have seen that Prof. Hamlin there had talked about chemo brain. Chemo brain more so as a result of the toxic effects of sustained drug use to help combat a tumor, say, in a different area of the body. And so it was to suggest that, look, there is a role here, but there needs to be some consideration around not for a direct targeted approach on that particular tissue. Others that shouldn't be considered for this are those that are taking any medication that increases photosensitivity. I don't know about you, but I've traveled to parts of the world where I've had to take medication to help combat malaria, where it suppressed my immune system response, but more so when I got back to Australia, that if I did have it, I'm in a place to get assistance. That medication increased my sensitivity to light, and that's something also not to be used. Women who are in pregnancy, we do not want any exposure to red light therapy in that. So there are some contraindications there for folk that have had a brain bleed, so an aneurysm-like stroke, where there's been a blowout in the pipes, in the arteries, in the capillary beds, and there's been a bleed into the brain. We don't want to add red light therapy photobiomodulation in a direct effect there, because let's think about it. Increased blood flow, increased angiogenesis. We're increasing those things that could contribute to exacerbation of symptoms. That's a no-go. So that gives you some scope or some boundaries about who should not possibly consider. Obviously, There's a bit of a wider conversation that if you're thinking about your own situation, then certainly feel free to get in touch and we can go through that, because we do have some tools that we have here. We use the Violite products. We have cranial headsets. We've got the nasal applicators. We've also got more systemic ones, which are those that are benchtop, so we can get it to the tummy or other areas. And that's particularly helpful for folk that may have had some trauma or effect to their brain as well, that where it's contraindicated. So I'm going to pause there because I can see a few questions here already. And again, I'm going to prompt folk that if you've got questions, because we've covered a bit of territory, that if you've got some of those niggling questions, let's get them out because I want to find more. Oh, captions on. Okay, it's difficult to lip read. Well, I might have to do a transcription, Noreen, for that. Troy has asked, could red light therapy be combined with 40 Hertz light therapy, which has been shown to be promising? Okay, very good question, Troy. With regards to the how that light is delivered in terms of, is it a consistent, continuous, synchronous beam, or is there a pulsing to that light? The literature, particularly for folk that have got cognitive changes, tends to support using light being pulsed at a frequency. So how many times per second at 40 Hertz is quite beneficial. However, it has quite an arousing effect. So this is something you wouldn't want to be doing as you're preparing for bed, for example. Alternatively, other devices have got the capacity to control that amount of pulsing. Some come equipped with having 40 Hertz, which is referred as gamma, and the other pulsing point being at 10 Hertz, which is in the alpha band. At the 10 Hertz, it seems to have an effect. Imagine like a car. We're in neutral, and that neutral allows us to drop into any gear that we might need. So in that context, we're thinking about how can I be in an idle but ready state to respond? Particularly helpful for folk that have difficulty coming out of a hyper-arousal state. Now, thinking that through, those are the people that have disruption to their attention. Those people that have difficulties with taking themselves out of an anxiety state to come into a more of a relaxed awareness open state. 10 Hertz, 40 Hertz may offer some opportunity there. That comes out of some of the work in the neurofeedback world. So where we're looking at trying to give the brain some feedback on its behavior. And we can look at the different frequencies from very low frequencies to high frequency, which is the 40 Hertz range. That's a great question, Troy. I hope I've answered that. Any other questions? So a question here, could 10 Hertz be helpful for those with hyperactive fight or flight response? The answer, I think, here is that it's a possibility of a strong yes, particularly if we're trying to then think about what can we do to help support the transition from being in that hyperarousal state to coming into more of a rest, and I can move to the state which I want to choose. You know, I can choose to move from that state to a different state. And it gives us a place to come to in sense of a neutral position. So to answer your question, there is a strong yes there. I'm going to put another caveat behind that one. It depends. If we target, say, frontal lobe, the front part of our brain, being possibly hijacked by that emotional regulation, being I'm hyper aroused, I'm having difficulty with my focus, then yes, we can also with some tools think about left and right. Which areas do we target? Do we target a left side, right side? And dependent on that, will also have an effect as well. Perhaps there's a goal around trying to achieve a certain task, and there may be a use to use 10 Hertz to start off with, but we want to then get in a state of idle readiness and respond to a task or a goal a little bit different, which might be sustained focused attention. And you could move to a 40 hertz setting to finish off where I'm trying to get into that arousal and focused for a specific task. So now we can see the use of the red light therapy with a task in mind or a goal in mind. Great questions, guys. Really, really powerful. Thank you so much for those that have contributed. I'm going to ask anyone else got any questions. Well, just to wrap things up, I'm really fascinated by this space. There's only some literature recently to talk about tinnitus of all things, where they were using red light therapy delivered through the ear. And again, much like the applicator from the nose, they're using a similar device, but at the ear. That was really fascinating. It was a Brazilian study where they did a randomized controlled trial following folk, and they demonstrated an effect, a reduction in tinnitus, the experience of the user. And I thought that was really interesting about having an effect on a particular symptom, which is really quite intrusive for many folk. I think if you're going to go out there and start to think about your own personal situation, get familiar with some of the literature or have a conversation with a health professional who's focused in this space. Think about what tools might be there. We've already touched on what spectrum of light needs to be helpful. We've looked at dose. There is a dosage response, and we haven't gone into what goes into dose, but remember, dose is important, and dose is controlled by how much energy is imparted. Energy can be imparted quickly, or it can be done over a period of time. The things that we control is how much, and therefore controls how long. So some of these devices that you'll see on the market, I would really caution. You'd want to be thinking those that have a time out function, ones that stop at a certain point, because that's just one of those protective functions. Okay, just another thing as well. If you're looking at doing this and you're wanting help with somebody like us, where we start off with is try and get a baseline of where you're at functionally first. There's no point wandering off in the woods and getting some sort of sense of, is it working or not, if we haven't drawn a line in the sand about where am I at now, what do I want to improve on, and how does this going to help me perform better in my life? Is it around mood? Is it around my thinking and memory skills? And how does that translate to my life? Very important that I think we keep a very functional lens, because, at the end of the day, this is a step into the future, a step into your future self, where you're wanting to make sure, am I doing this? That's smart. Start off with an understanding of where you're at. 2, what will success look like? What do I want to measure? 3, what's the right tool? 4, is it safe? 5, does it do the right things? 6, am I doing it right? So there's some of the little things there that we might need to think about along that journey. Folk, if you want any help in this space, we'd love to be involved in supporting you. We'd love to work with folk that are wanting to tackle their cognitive fitness and to improve their functional performance over time. If that's something where you're at and you'd like to connect with us, feel free to do so and reach out to us via this number here, or email us at support@gethealthcaredirect. That's GET healthcaredirect.com.au. I know it's a mouthful. I think I coined it to keep everyone good at writing, but I might leave it there. But if there's any last minute questions, please think I'll open up to the floor. Great question here. Is there any benefit for those with no neurological conditions or health problems? This is a great question, and there is a very strong yes with that answer. If we're looking about our cognitive fitness, what can we do to help support our cognitive performance in day-to-day life? You expect that through our day, we're doing a lot of mental work. And no doubt through our experience of these very unusual times, from COVID, lockdowns, mental health, even our sense of self-calm, inner ease. can all be helped with these tools. And I'd probably, if you're going to explore in this space, then maybe some of those tools like a systemic approach Violite product might be something you'd consider or look at. And remembering those light spectrums, you could look at something around the mid-6s to the 800s, mid-8s as being a target light spectrum to be of benefit. The current observation in some of the literature when we're looking at athletic performance, seeing this applied to help with using this tool at the same time as doing meditation type exercises, as doing mentally stimulating exercises. So what we're doing then is using the tools of the red light or photobiomodulation to help create the conditions in the brain. And then we're layering a positive task for ourselves that we're trying to get better at, stronger at, and possibly more resilient with. So we can think about meditation, we can think about using our mental skills, practicing a skill. And we see this in the sporting domain right now where that's getting great traction. Here in our clinic, what we're doing is we're using this tool and we're tying it in with our response cognitively, responding to stimuli, doing movements and decision-making reaction times, using cognitive training exercises at the same time. And that's us trying to imagine like an orange trying to squeeze as much out of those tasks as possible. That's a ripper question. Thank you. I'm reading my last question here. I'm not familiar. There was a question here about a different tool which had different applications across red, infrared, magnetic, and micro vibration. I'm not familiar around the transcranial magnetic stimulation field. That's something we've not got into as a practice, but certainly in red and infrared or near infrared, as opposed to far infrared, making sure we're talking about near infrared. So that's a spectrum of light that we've been talking about. And micro vibration, very interesting space there, particularly when it's looking at the role of touch stimuli and how it's trying to mimic different states or trying to promote different stimulation. And that becomes very interesting about how that micro vibration is added into the mix. We've used different tools here, and we've got one that we often use with folk that is using that micro vibration. So touch stimuli happening like a pulsing, and that's happening at a very low frequency, meaning it's happening low times per second, up to very high frequencies per second, dependent on what the goal state is. There's been some randomized controlled trials specifically around the use of that tool that we're comfortable and that we've been using. Not familiar with the tool that's been referenced here in the conversation. Folks, that's been, wow, that's an hour. I hope this has been helpful. Really appreciate any questions that you've put forward, and grateful for the contribution. One last question's come through, and I'll answer this. Could there be any applicability around sensory overload or involuntary movements triggered by sensory input? Great question. My answer is don't know. My answer would be theoretically informed, and I probably would be stepping on a few landmines in answering that accurately. So I'm going to I'll take a pause there, but that's a ripper question. If we think about how current therapy techniques are used around sensory overload, it's sometimes multimodal. That can be cognitive behavioral therapy, so my internal system response to stimuli. It can be stimuli exposures being small and graded over time, as well as looking at different interventions, pharmacological medication, as well as because medication can sometimes have a dampening effect. If we are to unpack that sensory overload, so stimuli coming in and having an aberrant response, an overt response to that stimuli, there may be too much of an excitatory footprint in that. But that's me just talking theoretically. So I'm going to leave that as an open answered. I need to have probably a little bit more of a look at that in the literature in that space, but I can't conclusively add really a strong amount of value on that one. All right, folks, thank you very much. Really appreciate your time here today. Ripper questions that have come through. Been very grateful for that. And yeah, I'm going to intend to do a few more of these. So this is number one. Look out for the next emails that'll pop up. We're going to try and commit to doing this about every fortnight or so to get this type of content out. I just want to get an idea. Drop it in the chat. Has this been valuable? Has this been helpful today? Love your thoughts there, and to hear what your thoughts are around this type of presentation and just sharing of information. Oh, you're welcome. Not a problem. And that's really lovely to hear. I've had a question that's happened offline about whether this will be available to folk to watch again. Yes, we'll put it on our website. We'll make it available. And when we do so, we'll let everyone know that it's there. I think the value is that when you attend, you get to ask your questions, which is great. All right, well, that's it. Let's wrap that up. It's been an absolute pleasure. Grateful for your attendance. I'm super excited to share a very interesting space around a tool that is having an effect. Wish there was more literature. It's growing. Positives that it's demonstrating some real positive things in safety and comfort. For me and my very small team, Jess here is shadowing and listening in today, we've just got that focus on how does it help folk improve their performance in life. Anyway, with that in mind, have a lovely weekend and appreciative of your attention. Thanks so much, guys. Bye.